Daniel Berger, and I'm a clinical endocrinologist at the Sansom Clinic. I also serve on the board of trustees at the Sansom Diabetes Research Institute. As we struggle through the COVID-19 pandemic, I know this is a very unsettling and distressing time, not only for the community and the world, but particularly for people who have diabetes. So with that in mind, I'd like to spend the next few minutes with you discussing some of the issues that have arisen with my patients with diabetes and what I tell them. One of the main questions that comes up is whether or not people with diabetes are at increased risk for contracting the virus. So far, there's no clear evidence that just having diabetes makes one at increased risk to be infected. However, as we know with other illnesses, if one has diabetes, their sugar may be more difficult to control. And we also know with COVID-19, if glucose control is poor, then that person may be at risk to have worse outcomes. So with that in mind, it's really important that people with diabetes get back to the basics in terms of caring for their disease during this time. And that means if one does have symptoms of any illness, especially COVID-19, to employ what we call sick day rules. So that means checking your blood sugars more frequently. If you are on insulin, making sure that you are taking insulin, keeping well hydrated, having carbohydrates around in case the blood sugars are low, possibly needing an increase in insulin dose, and also taking other medications as well as needed. I have also been advising my patients that if possible, they should try to stay out of the emergency room. Now, certainly, if they're having significant symptoms like severe shortness of breath, high fever, they need to contact their medical provider and probably do need evaluation at the ER. But if they're feeling a little sick or their sugars are a little high, the best would be to stay away from the ER, try to manage it as best they can. They can contact their healthcare provider to help them manage through the issue, preferably at home during this time. I've had a lot of concern from patients regarding getting their insulin and other diabetes-related supplies. This is certainly a dynamic situation, so things may be changing. But for now, it appears that there has been no problems in terms of patients getting their insulin or the availability of insulin, or for that matter, at least at the moment, technology-related supplies. However, I do have some concerns that if this does drag on for some time, those who are on insulin pumps and continuous glucose sensors, etc., that they may have some issues. So to be on the safe side, I think it is important to plan now to have appropriate diabetes-related materials on hand. So that means if a patient is on a pump, they need to have backup injectable insulin available, either insulin pens or syringes with vials, so that if they don't get their pump supplies, they can be ready. And that also means that diabetics should have appropriate blood glucose monitoring supplies with the old finger sticks. I know a lot of my patients are now just using continuous glucose sensors, but it's very important to have those backup supplies. Furthermore, as events are changing so rapidly, I think it's very important that patients have appropriate portals to stay in touch and resources available to them. So I'm recommending my patients go on different sites. JDRF, for instance, is certainly one. Sansom Diabetes Research Institute, SDRI, would be a great site that has links to many of these things. Finally, as we are all practicing social distancing measures and keeping physically separated from each other, I think it's really important that the community as a whole and our patients stay connected. And with respect to this, I think people can be creative in defining what this new normal is. I've had a patient who told me that she did a virtual dinner with a friend of hers. And I've had patients do virtual movie nights as well. So I think this is going to be really important for the psychological health as we all get through this. And I'm telling my patients, stay positive. one of the interesting things about having diabetes is that it really puts people with this disorder in a unique position to serve as role models for others in society in terms of having to deal with something that is always present, always causing stress and anxiety, but dealing with it and eventually overcoming it and even thriving. So for everybody out there, please stay healthy, stay well, and I hope this information was helpful.